Hello everyone, and welcome back to the channel. Before we dive in, a quick note. If you'd like personalized medical consultations, you can reach me directly on Telegram at My Private Doctor. This isn't a channel, it's my personal line for one-on-one advice. You'll find the link in the description below. Now let's get started. Today we're exploring decompression sickness, also known as the bends. Decompression sickness is caused by dissolved nitrogen and sometimes helium coming out of solution and forming bubbles in the blood and tissues during rapid ascent, whether that's in diving or high-altitude aviation. Two fundamental gas laws influence this physiology. Pascal's law, which tells us that pressure applied to a fluid transmits equally in all directions. Boyle's law, which explains that gas volume is inversely related to pressure, so as pressure decreases during ascent, gas volume expands. Clinical features symptoms usually begin soon after surfacing. 2% of cases within 1 hour, 60% within 3 hours. 8% within 24 hours. Central nervous system cases often present within 10 minutes, though symptoms can sometimes be delayed by days. System involvement and symptoms. Musculoskeletal, joint pain or swelling. The classic bends, muscle weakness, reduced mobility, nervous, numbness, paresthesia, confusion, seizures, stroke-like signs. Circulatory, arrhythmias, hypotension, shock, decreased cardiac output. Respiratory, pulmonary edema, pneumothorax, hemoptysis. Skin, rashes, necrosis, gangrene. Gastrointestinal, nausea, vomiting, abdominal pain. Urinary, hematuria, renal failure, retention or incontinence. Eyes, diplopia, retinal hemorrhage. Ear, hearing loss, tinnitus, vertigo, ear pain or fullness. Types of DCS: type I, pain only, usually single joint pain or swelling in shoulders, elbows or knees. Skin symptoms such as pruritus, a marbling rash called cutis marmorata, and pitting edema. Type II, serious. Multiple joint involvement and possible spinal cord injury leading to ascending paralysis, urinary retention, or fecal incontinence. Vestibular staggers with vertigo, tinnitus, and hearing loss. Pulmonary chokes presenting as cough, hemoptysis, and chest pain. Type III, all features of type II plus arterial gas embolism causing stroke-like symptoms. Differential diagnosis. When evaluating a suspected case, consider barotrauma of the ear, sinus, or pulmonary structures, arterial gas embolism, oxygen toxicity, nitrogen narcosis, hypothermia, carbon monoxide toxicity, other diving-related conditions. Evaluation diagnosis is mainly clinical. However, laboratory tests can aid assessment. A complete blood count, electrolytes, lactate, coagulation profile, blood gases, ethanol level, and toxicology screen. A useful bedside test. Joint pain that's temporarily relieved by inflating a blood pressure cuff over the affected joint to 150-200 mmHg. Management: immediate care. Ensure ABCs are stable. Administer 100% oxygen via a non-rebreather mask for at least 2 hours after symptoms resolve. Keep the patient supine. Trendelenburg position is not recommended. Start of fluids, for example, at 50 cc/hr. Definitive treatment: hyperbaric oxygen therapy, HBOT, as soon as possible, still effective even if delayed up to 14 days. High altitude or hyperbaric causes rapid descent to ground level. Supportive measures: consider lidocaine and perfluorocarbon emulsions as adjunct therapies. Transport considerations: prefer ground transport or pressurized air transport at altitudes below 1,000 feet. Disposition: admit the patient for hyperbaric treatment and close observation. Prognosis: up to 50% of patients may experience long-term impairments such as urinary, bowel, or sexual dysfunction when followed up 6 years after the event. Thanks for watching. If you found this overview of decompression sickness helpful, please like, subscribe, and hit the bell icon for more medical deep dives. And don't forget, if you need personalized medical advice, reach out on Telegram at My Private Doctor. You'll find the link in the description. See you next time.